Hey y'all, it's Costa. I help people break the system to build a better future. Today, I want to talk with you about the long-term care of COVID-19. Since the first known case of COVID-19 was reported in the United States in January 2020, it feels like our world has completely flipped upside down. As of late summer 2021, the US has reported about 36 million cases of COVID-19 and about 600,000 deaths. Before we get into the long-term treatment of COVID-19, let's take a look at what we know. COVID-19 is a highly transmissible respiratory virus that can affect each person very differently. For example, one person may look and feel completely healthy and still test positive for COVID-19. These individuals are considered asymptomatic. This is concerning because these individuals can unknowingly be spreading the virus to those people who are older or immunocompromised. For those individuals who are not asymptomatic, the side effects of COVID-19 can range from fever, cough, shortness of breath, loss of taste and smell, and many other serious and deadly symptoms. It can take about 2 weeks for the virus to settle into your body, or what is considered a 2-week incubation period. So there's plenty of time to spread it before the symptoms kick in. And if you are exposed to COVID-19 at any point, the CDC recommends to self-quarantine for at least 2 weeks. COVID-19 is a virus that attacks the respiratory system, which is a system in our body that controls our breathing. One sign you may have COVID-19 is the feeling of shortness of breath or difficulty breathing. While the majority of individuals' symptoms only last a few weeks, many report ongoing issues long after their initial infection and the typical recovery time. The CDC defines this as post-COVID conditions, and it describes any symptoms that linger 4 or more weeks after being first infected with the virus. Now, these chronic COVID effects can happen to anyone who has had the virus, from the most severe cases to those who were asymptomatic. The CDC also states that some individuals experience multi-organ effects of COVID-19. These typically only happen to extreme cases of COVID, but has a huge impact on their lives for many months after contracting the virus. Multi-organ effects means that all systems in the body are being attacked, from your heart to your lungs to skin and even your brain function. And another downfall of this virus being so new yet so powerful is we don't know the long-term side effects that could potentially arise in the future. And with 36 million cases reported in the United States already, this could heavily impact long-term care for many generations. So if you are suffering from long-haul effects of COVID-19, know your limits and ask for help. And I know this is an incredibly challenging time for younger, healthier patients, but if you are overextending your body during such a fragile recovery, it will likely lead to permanent trauma. Some COVID cases have also reported neurological side effects, such as dizziness, seizures, and strokes. The Mayo Clinic has also reported that COVID-19 may increase the risk of developing Parkinson's or Alzheimer's disease. Even in mild COVID cases and months after having the virus, scans have shown heart muscles severely damaged, which can lead to heart attack or other cardiac issues. So all of these conditions and side effects can lead to needing outside care. As you know, long-term care with or without insurance can be very expensive. With all of the long-term effects unknown at this point, it's hard to say if insurance companies will cover the lasting effects of COVID-19. Insurance companies are implementing even more rigorous standards and underwriting with applicants from ages 60 and older, recognizing this group which was most heavily affected and continues to be one of the most at-risk communities. What can you do to prevent COVID-19? Well, first, trust the experts. Social distance at least 6 feet, wear your mask out in public, and get your vaccine. If you are high risk, you may want to consider isolating a bit more than someone who isn't. You don't know what COVID could mean for you, for your family, or the people in your community. So it's best to take every precaution available so that we can live a long and healthy life.